Okay, so it's 9:32. I think we can get started. Thank you very much, everybody, for registering for this. That's going to be a very, very, very useful webinar. I can assure you that. Jayne is going to be wonderful, like she was last week. My name is Gaetano. Many of you might know me. I'm the customer support manager at Restless. So my duty today will be to act as an intermediary between you and Jayne, who will be managing the whole webinar. So she will be telling you about a bit of housekeeping, how to interact with her during the webinar, and any questions I'll be mainly supporting you if there is any problems, and at the same time transfer your questions to Jayne during the Q&As. Okay, thank you so much.
Thank you, Gaetano, and good morning, everybody, and thank you very much for joining us on this webinar this morning. As Gaetano said, we've had a webinar like this before. We did one last week, and we had some positive feedback, and people found it useful. So I hope it's the same for you this morning. I hope you get something useful out of it. We would welcome any feedback from you as well, which would be great, and you'll be sent an evaluation form later on. So just a few things for housekeeping purposes. You will remain on mute, please, and your video's off while we're doing the webinar. There is a chat facility, so any questions at all, if you just write them in there, and then when we sort of stop for some Q&As, there'll be plenty of opportunity for me to sort of answer those questions. We've got a couple of breaks added during the morning, because obviously I appreciate it's a long time, it's 3 hours, but hopefully you'll find the content useful and not the session not too long. So just to give you a little bit of background about me, I've worked in the NHS for a long time. I trained as a nurse in London and qualified in 1981. So I'm in my early 60s, so I fit quite nicely into the Restless membership category. So my career has been quite varied. So I did my initial training, and then I stayed in London for a little while, worked on quite a busy ward in teaching hospitals, and then I worked on the district in Bromley in Kent, and then came to live in Sussex probably about 30 years ago, and have lived and worked down here ever since. I used to work for East Sussex Healthcare Trust, firstly as a nurse and night sister, and then I sort of went into education, and that's where I've sort of stayed sort of since, and sort of developed my career from there. I took a secondment a few years ago to Health Education England, and now I work locally, predominantly promoting NHS careers and in social care equally, and also just generally sort of pre-employment initiatives. So I work with a range of people across Sussex. So for example, the Prince's Trust, all our NHS organisations and social care organisations, local authority, to try and sort of join up things so that we're sort of working together to promote our sector, and hopefully to get people to think about coming into our sector. Just to give you some idea about why we've put on these workshops. Traditionally, we've had our usual routes for people to come into the sector have been via perhaps with targeted schools and colleges, and I think sort of the pandemic has made us think quite differently, and we need a variety of people, a variety of age groups to think about coming into our sector. And we did some research with Restless and Restless members about some of the perceived barriers about coming into health and social care roles and careers. And we got some consistent feedback about there was some sort of perceptions about who could and couldn't work in the sector, and perhaps somebody that's slightly older may not be as welcome to somebody younger. That there was a great deal of physicality about working in health and care, and that as we all get older, we might find that a little bit more challenging, and don't necessarily want that as part of our day-to-day job role. And then sort of perhaps people didn't think they could retrain, and that the NHS or social care wouldn't want to invest in people who were older. So hopefully this morning we can dispel some of those myths, and give you some ideas of different roles that you might like to consider, and some opportunities that are out there, currently. So the programme this morning is very much about that. First bit is about sort of looking at the health and care sector, and hopefully you can see that there are for opportunities in both health and the care sector, for people thinking about changing their roles or developing their careers, perhaps in a slightly different direction than they'd originally sort of considered. We will have time for Q&As and a break. We'll look at the application process, because that was another area that was highlighted as a bit of a barrier. For any of you that have completed an NHS application form, you'll know that it's not a quick task, and it can take a little while to do. And some people find that a challenge, and it puts them off going any further. And then if they're unsuccessful, it seems like quite a sort of, a big piece of work to unpick and work out. But hopefully you'll get some ideas and some hints and tips this morning about how that can be a slightly easier process. We've also later on this morning got somebody called Gillian Reynolds. Now, she's the patient experience lead and the voluntary service lead at East Sussex Healthcare Trust, which is the trust that's in Eastbourne, Hastings and Bexhill. And she's very keen to encourage people to come into the sector to volunteer. And volunteering can be but can be volunteering, or it can actually potentially lead to employment later on. People get a taste of what it's like and then want to sort of go a little bit further. So Jill will be able to tell you about that and how to go about that. And obviously you've got an opportunity to ask her questions as well. And then for the last section, we're just going to look at training and education in the NHS, including apprenticeships, because there's lots of myths around who can do apprenticeships, who they're aimed at. But hopefully you'll be quite interested to see that it's quite broad, and lots of people can do apprenticeships at different levels and different qualifications. And hopefully you've got plenty of time to ask any questions this morning. And I'll also give you a contact email address at the end. So if I haven't covered something, or you're not quite sure, you just want to ask a question, you'll be able to email me in this mailbox, which is on one of the last slides. So I think I've sort of broadly explained this. We're looking at some of the myths and stereotypes about working in health and care, to look at some of the opportunities in both of the sectors. And it's a bit about signposting as well. There's some flyers, and you'll be sent these as well, and also a copy of this presentation for your information. And as I say, it's an opportunity to ask any questions that you may have. I wanted to sort of tell you who I'm working for at the moment, and it will give you an idea of the kind of health and care landscape at the moment, which will hopefully give some clarity, because it's a very confusing landscape in terms of where everybody sits, and there's lots of sort of changes happening, and especially with COVID, lots of changes have happened very quickly. So I work for the Sussex Health and Care Partnership, and it's what they call an integrated care system. A couple of years ago, the government divided the country up into what they called footprints, and originally they were called sustainable transformation partnerships. And the idea behind this was that services, perhaps in Sussex, lots of coastal areas, lots of rural areas, the services might be very different that are required. So some services that might be required in a sort of more urban area, central London, for example. So it's about making the services appropriate and resourcing them accordingly for the demographic. So in Sussex, we have just become what they call an integrated care system. And very, very simply, what it means is that everybody that's involved in the sector, so the NHS organisations, GP practices, CCGs, local authorities, we're all working together so that we have joined up services. Because what potentially could happen is that one area could be working on something that's a really brilliant idea, but it's not replicated across the county. So East Sussex, West and Brighton and Hove, that makes up obviously the whole of Sussex. So it's making sure that we're all working together. So it's a very new way of working, but hopefully it'll give you an idea. If you work in the care sector, you could sort of transfer across to the NHS sector, health sector. So which makes it sort of gives you more opportunities, really. So that's just to give you an idea of how the systems are working at the moment. So in my role, which was about pre-employment and promoting careers, before we had the pandemic, I think mainly a lot of my work was with schools and colleges, working with teachers to promote the sector, making young people aware of what we could potentially offer as a career. We did do some work with other age groups, predominantly through the DWP and job centres. but obviously we've had the pandemic, and it's made us look very differently at how we do things. So for example, this morning doing something virtually like this would have been unheard of sort of 18 months ago. It would have been a face-to-face event. So we have changed the way we do things. The other thing that's really focusing us as well is that we've got, this has been happening for a little while now, we've got an ageing workforce. We've got an ageing population. People are living longer. They're often living longer with several things wrong with them. So for example, we may have somebody living till 85, 90, but they potentially have they could have heart disease, they could have diabetes, they could have mobility or sensory impairments that make them need more of our services. So we need more investment in terms of people coming into our sector to look after our population generally. And if you think about, where we're based, sort of in Sussex, a lot of people think about coming to retire in our area, perhaps along the coast. So we have a lot of older people just naturally living here. And then we have young families coming in, and all that infrastructure needs supporting in terms of health and care. So we need a constant pipeline of people coming in. So we're trying to look a little bit more creatively about how we attract people into the sector. Now, COVID had a massive impact on the NHS, and it's, daily, you'll know it's in the news for obvious reasons. Back at the beginning of the pandemic, the government asked for some volunteers, and they were looking at 250,000. That's what they thought would help the pandemic at that point. But we got 750,000 people responding to that call for volunteers to support the NHS. So we've had overwhelming support in our sector. Just recently, to give you an example, we needed people to support the national mass vaccination programme, and the area where it was managed in Sussex was sort of overwhelmed by the number of people. I think we had something like 2,500 people apply to give the vaccines. So that was people coming out of retirement, people that just wanted to help, people that wanted to be trained to help. So another really positive response. And the other thing that just to mention that gives you an idea about how popular it is at the moment to think, for people thinking about careers in the NHS, we have something called the Health Careers website. And you can see by some of the stats on there, that the traffic has increased dramatically. The obvious ones that you might think would be popular anyway, like becoming a nurse, becoming a paramedic, have been very, very popular. And we've just had some stats in about the number of people applying to do nursing. I mean, for the last few years, we've struggled to recruit people into nursing, and we had about 36,000 vacancies. But I understand, I think the applications to university to start the courses in September have gone up something like 30%, which is incredible. So all of this is having a massive impact on our sector in a really, really positive way. And some of the other areas where people are looking to work are becoming a driver, becoming a porter, working for NHS 111 services. So really, really positive. If we look at the care sector, I think it's fair to say that they've sort of had a tougher time than us in terms of the recruitment. There's been some negative publicity perhaps about the sector in terms of at the very beginning of the pandemic. There was criticism that they didn't have enough PPE in some of the care homes and nursing homes. And a lot of their staff have struggled during the pandemic because obviously they're a smaller workforce, often working in small independent homes. But all the PPE issues have sort of been sorted out now. Hopefully they've got enough. And I think, in fairness, some of the criticism wasn't fair to them, because if somebody's working in a care home, a residential home, they were never going to be geared up for a pandemic, because that's not the nature of their business. So it's been quite a struggle for that sector. And as a consequence, I think there's quite a few vacancies. A lot of staff have worked extremely hard in the care home sector. I mean, you've probably seen on the news, people have even been sort of staying in care homes to look after their residents, so they're not bringing in infections. So they've gone, above and beyond. There was a recruitment campaign last year, and they've just on the 9th of February started another recruitment campaign for social care, called Care for Others Make a Difference. And it's really about trying to get people in to support this sector. As you've seen, the NHS, we've had lots and lots of support, but equally the care sector needs support. And the reason why that is so important to the NHS is because we need this flow of people coming out of hospital, going back into the community. So if somebody's been in hospital and they're slightly older and they need some care support, we need to make sure that that service is robust and can support the people coming through. And we talk about a patient journey or a service user's journey. You know, we need the care and the NHS sectors to work together. We need to make sure that we have enough staff in both sectors. Because if there's, you know, if somebody is waiting to go home and there aren't any beds in the care sector because there aren't enough staff, that actually stops somebody leaving hospital, which obviously is taking a bed from somebody that may need it more acutely. So we need this flow through our system. So it's really, really important. So that the care sector, they've got their recruitment campaign. You may have seen some adverts on telly or on ITV at the moment promoting the sector. There is a portal that people can access directly. You can put your details in, and then and also where, you know, the local authority where you live, and then you'll be sent the relevant information. So that's something just to be aware of, because hopefully at the end of this you'll see that there are opportunities in the care sector that can be just as good, just as interesting as the NHS. So I've divided this up into sort of two sections. So tell you a bit about the NHS to begin with, and then the care sector to give you that overview, and then you'll see how important both sectors are to the whole system. So you may or may not be aware that we're one of the largest employers in the world. We've got approximately 1.5 million staff. Obviously, this varies a little bit over, you know, from month to month, but as a ballpark figure. And if you look on the chart there, you've got McDonald's with 1.9 million and Walmart with 2.2 million. So we're right up there with some of the big multinational companies. And as such, we're able to offer our staff lots of opportunities. There's a lot of investment in the NHS and a lot of investment in education and training to make sure our staff have got, you know, the appropriate skills to look after our patients. We typically quote about 350 career opportunities in the NHS, and there's a whole range of different areas that people could consider working in. And if you can imagine the NHS being a bit like a town, all the people that are sort of, you know, components of living and working in a town are needed in the NHS, whether it's sort of, you know, the doctors, nurses, but also some of the areas where you might not expect to be able to find jobs. And one of the interesting things that's happening at the moment is that, you know, job roles are changing just because of the way we're working and how we've responded to the pandemic. One of the key findings that we've realised in the last year is that we need a very agile workforce. We need people with generic skills that can move into different areas as and when needed. And that's been a key piece of learning. So, you know, people coming into the sector, having some training, should be able to find some roles that are really, really interesting, and then they can sort of decide where they want to go from there. But there are different types of roles developing, you know, as we speak, and roles that perhaps we didn't need 3 or 4 years ago are now needed, and we're developing those roles with some education and training around them. So just to sort of make the point that it isn't just about the clinical staff, I thought this would be quite interesting to look at. So we've got doctors and dentists, nurses and midwives, and when you look at listen to the news, you know, it's nearly always about the clinical staff, but they make up approximately 37% of the workforce. So this is very approximate. But if you look at the other areas, each and every one of those sectors are very, very important to the whole system. You know, the doctors, nurses cannot work without all those other people supporting them. It really is a team effort. And what is very significant in the NHS is that every job role impacts on the patient in some way. So you could have somebody working in an admin role in an office where they're just working in a very small team, but their role will be important to the patient at some point along their journey through our services. So if you just have a look at some of the other roles on this chart, on this pie chart, there's healthcare scientists. Now, obviously, there's been a lot of publicity about the work they've been doing, you know, incredible work in terms of developing the vaccine, all the testing. So that is an area that perhaps not many people are necessarily aware of, but actually really, really important to the whole system. Allied health professions. Now, this is a very important and expanding group of professions. The allied health professions encompass roles like occupational therapy, physiotherapy, podiatry, radiography, and some of the sort of the lesser known professions, but really important. So, for example, we have speech therapists, drama therapists, music therapists, that all sort of sit in this sector. And actually, you know, people with those sort of skills, people that have perhaps been to drama school, you know, a while ago, may have the skills to come and work in some of those areas. We have some national shortages in some of those professions. So, for example, we've got a national shortage of radiographers. And there's two types of radiographers. We've got the diagnostic ones, which take the x-rays, do the scans, and the therapeutic radiographers that deliver radiotherapy. Now, we've got shortages in both of those areas. And you know, the pathway to becoming a radiographer could be directly to university, but equally it could be via training in a local NHS organisation via the apprenticeship route, which I'll talk to you a bit about later. Also on this chart, you'll see we've got obviously the ambulance staff, and you know, we have an ambulance trust in Sussex, South East Coast Ambulance Trust, a massive organisation. Obviously, it has the clinical staff, but it will have admin staff within that sector too. So that's something to think about. You haven't necessarily got to think about working on the ambulances. It could be sort of a behind the scenes role, but within that sector. You know, the NHS 111 staff, absolutely essential to getting, you know, people out on the road, people refer to their GPs. So those are some of the roles you might sort of think about there. We have managers, so people that have those transferable skills that they've used in other sectors would be very welcome in our sector. Hotel, property and estates, all of our buildings have to be maintained. So we have a whole range of different professions looking after our buildings: electricians, plumbers, carpenters, people that work in housekeeping, you know, people that cook our food for the staff, for the patients, and keep our services clean, and that's been very important at the moment. Health informatics, so IT services, and as somebody I personally am not very good with IT, so we need a lot of support, you know, working from home, working remotely. They've sort of stepped up and had to support staff, you know, in great numbers to keep our services running. HR, you think of the number of people we've got in our sector and people moving around, changing jobs, coming in. I mean, just recently that the HR team that have managed the recruitment for the vaccination programme have worked extremely hard to process everybody. It's taken them, you know, they've worked long hours, but their skill set has actually been brilliant and got people into the sector quite quickly. And then you've got all the support staff that actually support the people that have the sort of the qualified roles, if you can understand what I mean. Like perhaps they've got the doctors, they'll have physician's assistants, the nurses will have healthcare support workers, maternity support workers. There'll be support services within allied health professions, so you might have a therapy assistant. All totally important to the sector. So I wanted to show you a patient scenario. So this is to give you an idea of how people access our services and also what they call the journey through the services. So this particular scenario is about a young lad who's been playing football and hurts his leg. So it is a flow chart, and what I'll do, if it goes ahead, I'll sort of stop it and then we can have a look at the end. Sorry, I've just had a delivery. One of the pitfalls of working from home. So this, as I say, it's about a young lad playing football that injures his leg, and his friends then dial 999 to get him an ambulance. So if I just go to the end of this and then stop it. Okay, so you can start to see just on this first part of his journey the number of people that he's going to come into contact with. So you've got the medical dispatcher, you've got the paramedic and emergency care assistant, picking him up from the football field, taking him to A&E. Now, as soon as he goes into A&E, he'll meet a couple of people that are actually key to getting the flow of people through our system. So the porters, they'll know everybody in the hospital. They know where everybody's based. They'll be able to take the patient very easily to very different, to different departments. And also the receptionist, they're at the sort of the shop window of our services. And if you go into a reception and somebody isn't very happy or very smiley, you can actually sort of make or break your visit, as it were, and give you quite a sort of perhaps a jaundiced view of services. If somebody isn't happy, if they're bubbly and happy and helpful, actually that is such a good start to somebody's journey through our system. Somebody that's good at communicating, that can direct people, acts professionally, and that receptionist role is quite underrated, I think, because it's key to that start of the person's journey through our system. So the triage nurse, they will assess the patients to see whether they need to be seen immediately, or perhaps they can just wait while some of the more emergency cases can be seen. Doctors, emergency medicine doctors, the diagnostic radiographer to take the x-rays, the phlebotomist, that's a role. Now, a lot of staff working somewhere like A&E can take blood, but the phlebotomist has very good skills in terms of this is their day job. They do it all the time. So if a doctor or a nurse is having trouble taking blood, they may ask the phlebotomist, or they work in places like outpatients where that's what they do all day. It's a really popular job role, and actually the jobs don't come up that often, but there is a job I've noticed on the website, NHS website yesterday. There is a job for a phlebotomist if anybody's interested, with training, but I'll tell you about that a bit later. Then we've got the scientists in the labs, so doing taking the blood tests, analysing them, and then giving the results so that the medical staff can provide the treatment. If someone goes to theatre, has an operation, there's a whole team. So you have the people that you may be more familiar with, the surgeons, the anaesthetist, but there's also an allied health professional there called an operating department practitioner. So they work in there, and they're specialists in working in theatres. We have theatre nurses and healthcare assistants, and there'll be a porter there as well. You'll have admin staff to support those clinical staff. So the porter takes Danny to the ward, and then he's going to be looked after, because of his age, by the children's nurse, paediatric nurse, and healthcare assistant. So that's the first stage of Danny's journey through our system. So the second stage, and this is where he may come across people, or they may be working behind the scenes, so he doesn't actually see them. But if he's in hospital, he'll be sort of being offered some food. So we do have chefs. He'll need clean linen and laundry. So there's a whole team that provide that. I'll just stop that. Sorry, just go back. And then obviously you've got the people that will be looking after him, following him up. So like his orthopaedic surgeon. If he couldn't get home, if his family hadn't got access to a car, couldn't get him home easily, we do have a patient transport service. So people can actually work for that service without it being like the acute ambulance service for the emergencies. This is taking people to and from places. So it could be taking them to day centres, taking them to hospitals. Physiotherapists, then you've got the GP and the practice nurse. And the GP and the GP practice is becoming quite a hub now. There are a lot of professionals working in there. So you might see a paramedic in there. You might see that the physio, an occupational therapist, dietitian, health visitors. That team is getting quite big. And that is supported by a practice manager, and admin staff in terms of the receptionists. Sorry, my presentation's got a mind of its own. Obviously, you've got the GP, there will be pharmacists working with that surgery, and then district nurses, occupational therapy support workers to make sure that he can do the things he needs to do, and then getting back at home again and playing football. So this journey is a particularly simple one in terms of Danny's only young. He probably hasn't got anything else wrong with him apart from a broken leg. So his journey was quick and simple, but he also needed an awful lot of people to look after him, and the people behind the scenes. You can start to see how many other people there are involved in quite a simple journey. If you can imagine somebody perhaps that's older, and they might start to be having some things wrong with them, they're going to need more input. They're more of the clinical team perhaps involved, and more of the support services to get him home, and then supporting the community as well. But on that list of people there, some of the areas where you might be surprised that we have staff. So for example, we do have gardeners. If you think about a lot of our hospitals in Sussex, they've usually got very well kept gardens, a nice entrance, nice and clean and bright, and there's usually some shrubs and things. They all have to be maintained, so we have gardeners. We have the estates and maintenance staff to actually make sure that everything's in good decorative order and maintained, so it's a safe environment for people visiting, and also inpatients and staff. The other area I just wanted to sort of point out to you was the librarians. All of the bigger hospitals will have a library on site because staff are training, they're enhancing their existing skills, building on them, taking additional qualifications. So we have access to librarians as well. Okay, so just to give you an idea then of some of our NHS careers, and you can start to hopefully see that there's a lot of people, a lot of areas where you could potentially work. Put social care on there as well, because if you're thinking about our integrated services, health and care need to work together and are working together. And you've got public health on there as well. So that's been very pertinent at the moment in terms of giving out some messages about COVID. So all of these sectors are really, really busy, and we need a lot of people to sort of fill these roles. So thinking about who can work in the NHS, one of the key things is we want to make sure that we get the right kind of person coming into the NHS. Basically, we need people that sort of care, that want to do their best, that are committed to sort of providing a good service to our patients, and also people that are good with working with other people. But there really is quite a lot of different roles that people could consider. So perhaps some people might not feel that comfortable working directly with patients, but may feel happier working perhaps in a laboratory or in an office, somewhere a little bit behind the scenes, a more supportive role. And equally, that's fine. There is something for everybody. Now, I wanted to mention the values, because every single NHS organisation, and we've got 7 NHS trusts in Sussex, they will all have their own values, their trust values, based on these values of the NHS Constitution. And I wanted to mention it just because when you're writing your application, when you're doing your supporting statement, the values are quite important to be aware of. And also if you get to the interview stage, then very, very important, because you might be asked to demonstrate how you demonstrate the values of that organisation. So it's good to have an awareness of them. We have got something called the eValues tool, which is on the NHS website, where you can do a little quick test to see whether you have got those values. People that have worked in other sectors, if you've worked in retail, if you've worked in the airline industry, you will have these values. Would probably have been a part of your previous roles. So most people have got sort of transferable skills wherever they've been working in the past that can be aligned to some of these values. So it's just thinking about what you've done in the past and how you could sort of demonstrate that you have the values that we're looking for in the NHS. There are various sort of entry points to come into an NHS job. So I'm going to hear a little bit about volunteering a bit later on from Jill. Some people volunteer for a while and then think about coming to work in the sector, and that's quite a popular route. Some people volunteer and they do it so well they get offered a job. I've known that a couple of times. Sometimes people do some work experience. This predominantly has been for younger people, but we're becoming more and more aware that we need to offer that opportunity to everybody. It needs to be, not just focused on school leavers, but actually all of our population, if they're interested in finding out a little bit about an organisation, trying some sort of work experience to see whether it's what they're expecting. So some of our trusts are already working along those lines. We're also currently offering, this is for students, but we're going to try and open it up to do some online virtual work experience. So that's something in the pipeline for the months ahead. We also work with the DWP and the local colleges and sort of tap into the sector-based work academies where people can have some, well, at the moment it's virtual, some information about the sector and work towards a level 1 certificate in working in health and social care. Each of our NHS organisations has what we call staff banks, so that a bit like an internal agency. So if, for example, somebody goes off sick, if it's like a ward department, the ward manager would ask the staff bank to provide them, say, for example, a registered nurse, and the bank hopefully would be able to offer that. So people work on the bank as and when they're needed and as and when they want to work. So it's a very, very flexible way of working, and it suits a lot of people that have other commitments. And sometimes people work on the bank and then decide, once they've tried out a few departments, tried out a few different roles, where they want to work, and then apply for a job. Equally, we have a lot of our contracted staff, our permanent staff, working on the bank to top up their salaries if they want to. And that's often it's weekly paid. So it suits some people to work like that. So they may think about working part-time and then topping their salaries up by working and having the flexibility of working on the bank and still earning sort of a full-time rate effectively, but working according to when and where they want to work. So that suits some people. Sometimes people come in and they get a job which is an apprenticeship effectively, and then they do their apprenticeship with us, and then they apply for a post or get offered a post at the end of it. We also get people coming in following completion of courses at college or university. But what is very important to us is people that have worked in other areas, that have gained other experience, life experience, work experience, and that can come into our sector, and we can desperately need those skills, those transferable skills. So it isn't just based on sort of young people coming into the sector. We need a range of ages, we need a range of experience at all stages of the NHS, in the NHS team, and also in social care as well. So I had a look at the vacancies yesterday in Sussex. Now this is on the NHS Jobs website, so this is the usual place to look for jobs. You will see NHS Jobs advertised in other areas as well, but this is the main place. So there were 83 vacancies yesterday. And we look at the agenda for change. I looked, my search terms were agenda for change, pay bands 1 to 4. Effectively, it's bands 2 to 4. I'll show you in a minute, but the band 1 is sort of disappearing. It's actually become sort of band 2. So that's for, in terms of pay. So these are sort of roles that people might want to consider if perhaps they want to work in the sector. They haven't got formal qualification, so not necessarily an allied health professional or registered nurse, scientist, but perhaps would like to work in those sort of areas or already have a skill set that fits into some of these roles. So you can see on there yourselves, there's quite a few, it's quite a range actually. And what I noticed yesterday, very few jobs had the same title. There was a few healthcare assistants working in different departments, but there's a huge range on here. So the help desk coordinator, so that would be working in somewhere like the facilities department, fielding phone calls from people that perhaps have got a fault on a piece of equipment in a department. A very, very busy role, but quite an interesting role as well. You get to talk to lots of people, so quite a sociable role really. The next one, the diagnostic imaging assistant. Now, I mentioned earlier that we've got a sort of a shortage of radiographers. Now, if somebody wanted to consider something like that, a diagnostic imaging assistant, that's working in the X-ray department, supporting the radiographers. There is an apprenticeship to become a radiographer, so somebody could start working in that department and perhaps work towards an apprenticeship to become a radiographer, do a degree apprenticeship. So that's just to give you an idea. We've got porters there, therapy assistants, so that could be working with occupational therapists, it could be working with physios, the speech therapists, the whole range of the therapy assistants. Some that you might be a bit more familiar with, there's facilities, housekeeping, telephonist, cashier and accounting officer, so be working with like an accountancy team, So that if you like figures and you're good with figures, that might be something you might want to start working in. And then potentially that department may offer you the opportunity to do some accountancy exams, just to give you an idea of how you could how you could work and sort of develop your career. The next one I think is quite an interesting one. So it's a peer support worker. And this is working for Sussex Partnership Trust, which is the mental health trust. Now, a peer support worker that they're asking for is somebody that has autism, but could support people with a mental health problem that also have autism. And I thought that was quite an interesting role. And that individual would be paid to support somebody that is going through, a mental health problem, but who had autism. So I just thought that was a good one to throw in, because I think it's quite a specialised role, but it may suit somebody. There's admin assistants, there's ward clerks, the phlebotomy role, I think that's the one I mentioned also. You don't often see roles for phlebotomists. Now this is a Brighton-based one. I think it was at Brighton and Sussex University Hospitals, but they were going to train somebody, and to get the training is sometimes quite difficult. So with the phlebotomy role, once you have got the qualification, you could end up, obviously you could work in the phlebotomy department taking the blood, but equally later on, a bit further down the line, you might want to consider working in a GP practice. We have community phlebotomists as well, people going out and taking blood in people's homes to save them coming into our services. So I thought that might be of interest. The pharmacy assistant, there's lots of apprenticeships in pharmacy where people can actually work their way out and become pharmacy technicians. But that's an area that's really expanding. I mentioned you might get a pharmacist in a GP practice. Pharmacists are giving the COVID vaccine at the moment. That their roles are expanding. The other one I saw was a charity assistant, and I've never seen this one advertised before. This was again at Sussex Partnership Trust, but it was to providing support for raising money for the charity that Sussex Partnership support. So I just thought that might appeal to somebody that's got that sort of background. And then you've got the project support, personal assistant. That was a sort of admin role, personal assistant. TWS is temporary workforce services. So that is one of the staff bank roles. That's at East Sussex Healthcare. So that's working in the facilities department as and when. So it could be working in the restaurant. It could be perhaps supporting with some of the housekeeping roles. And then there's a driver there, transport driver. There's another imaging support worker role. A night sitter to actually look after somebody in their own home, and an A&E receptionist. So quite a range, and that's a snapshot on one day this month. So I mentioned the agenda for change, the pay scales. I'm sorry, this isn't a very clear picture, but if you just Google agenda for change, you'll get a clearer picture. So I said band 1 is sort of disappearing. It's because band 1 and the bottom of band 2 are the same sort of salary. So band 1 is going. So the roles I showed you are bands 2 to 4, and you can get an idea of some of the pay here. So if, for example, it was a porter working at the bottom of band 1, with overtime, they could increase that amount. Working on social hours, people get an enhanced rate of pay. So from a nurse's point of view, if we worked from 8 in the evening to 6 in the morning, we had time and a third paid to us on our hourly rate. And then that went up to time and 2/3 for Sundays and bank holidays. So just to give you an idea. And then equally, if somebody was on that sort of salary and wanted to earn a little bit more, they could do some hours on the bank. And at the moment, our services are quite stretched, so people are actually, working on the bank to supplement their salaries as well. So that can just give you an idea. Band 5 would be for registered staff. So, for example, a newly qualified nurse, physio, OT would start on £24,907. In some of the areas where we've got shortages, so just thinking about nursing, within a couple of years and getting some experience and a little bit of further education, a band 5 newly qualified nurse could be in a position to apply for a junior sister's post, which would be at band 6. So then you can see the sort of the jump in salary up to sort of 31,000, and obviously they'd get enhancements as well around that role. A band 7 would be could be a senior admin perhaps a personal assistant to the chief exec, that sort of role, matron. So you see band 7, and then you've got the band 8s, A, B, C, and D. That banding is for senior managers, and then band 9 would be for directors. So just to give you an idea of how the pay works. So the benefits of working in the NHS, we have a standard 37.5-hour week, and I've just mentioned that you get enhancements if you work outside of those hours. We start off on 27 days annual leave and the bank holidays on top of that, and that rises to 33 days after 10 years service. If you're working in a role where you have shifts, so I can tell you this as a nurse, we used to do 12-hour shifts, still do 12 hours, but you could work, say you work 3 days at the beginning of the week, perhaps Monday, Tuesday, Wednesday, and then you worked at the end of the next week. You get a week off effectively in between your shifts, which is quite nice. And then if you add some annual leave as well, you can potentially have quite a lot of time off for other things that you want to do, or if you want to work on the bank, however you want to sort of manage your life. But there is some flexibility there to manage your life around working in the NHS. So there's a right to request flexible working around your other commitments, and we have a good pension scheme, and then we get free services in terms of occupational health and counselling. All the DBS checks, uniform, anything that you need to do your job would be paid for, and that can be really good. DBS checks, if you have to pay for them, can be quite expensive, especially if you're working for several employers. So that's all paid for you, and all your anything you need as part of your recruitment process. If you needed immunisations, anything like that would all be given and done for you. We have a national NHS discount scheme, and we also have local schemes as well, where the trusts negotiate discounts with local, I say restaurants, it's probably not very appropriate at the moment, but in normal times, there's some good discounts with local providers. We get study leave if we're on courses, and we get an annual appraisal. Now, the annual appraisals are really good because you get an opportunity there to sort of look at your development, where you want to be, what kind of skills would you like to do your perhaps next job, what would you need to do to carry on and enhancing your current role. So really, really important part of working in the NHS. We've got the Step into the NHS website, which is really good. It's just been revamped and it's very user friendly, loads of information on there if you're interested. And one of the things that you can do is sort of map your career. So you, based on your you do the career mapper quite quickly, and based on your interests and your sort of experience, you'll get an idea of what roles you could do in the NHS, and then also then research what you need to get to where you want to be. So what kind of qualifications do you need if you're changing your career. And then we've got the Health Careers website, which again has got lots of information on there. So I don't know whether you just want to stop for a couple of minutes and just see whether you've got any questions, and then I'll go on to the care sector.
Hello, me again.
Hi.
Thank you very much, Jane, and thank you very much, everybody, for being here again. We have 3 questions, so we can actually 4. Thank you very much. Okay. So let's get started with the first one from Lindsay. She's asking, this might be spoken about during the talk, but if I wanted to become an audio secretary for the NHS, it says that you need to know the phraseology and NHS systems. Is there any training available? I'm a legal secretary at the moment.
Okay, thank you. Lindsay, I think sometimes you might be able to find a course that talks about like medical terminology. There are some really good dictionaries that you can get that's got the medical terminology. There's one called Balliers. It's a nursing dictionary, but it's got it's got all the terminology that you would need and the acronyms and abbreviations and things. I think any systems that you need training on in the NHS, because obviously we've got slightly different systems, and you'll probably find that from one trust to the other, they've got slightly different systems. They would probably provide you with some training, so don't let that put you off. I mean, you could probably have a look on the internet to see whether there were any sort of short courses about the medical terminology. But as I say, with regards to the systems, you'd get support with that if you've got the job.
Thank you very much, Jane. Christina is asking, at the age of 62, are there any training options?
Hello, Christina. Well, I'm 62. They're still training me. We'll talk a bit about apprenticeships a bit later on, but there's lots of in-house training that you can do. You can do an apprenticeship at 62. It can be just a short apprenticeship. You haven't got to do years of study unless you wanted to. But there are lots of options. And I think you might be surprised at what you could do. I mean, just recently, I was sent. I was probably about a year ago. They sent me on a leadership program, all paid for. So there are opportunities for development, and they don't ask your age, so that's not really a big issue. Okay.
Thank you very much, Jane. Another question. Unfortunately, I don't know the name of the person who has asked the question. Can Jane talk about parking at the hospitals, as this puts many people off applying for roles, especially in Brighton?
Oh, okay. Now, I think when the pandemic started, obviously the parking was an issue to get staff in. So as far as I'm aware, certainly across Sussex, they scrapped all the fees for parking. Parking is difficult in Brighton, and I think they recommend that you take public transport if you possibly can, just for your sanity of trying to find a parking space. All the sort of the metered space is quite expensive, but if it's in hospital grounds at the moment, I believe it is free. But don't let that put you off, please. Thank you.
Thank you, Jane. Another question, I think it's related to the social media engagement. What if you don't have Facebook? In
terms of what engaging?
I think it's in terms of getting in touch with the NHS, with the possibilities of gathering information on the vacancies, on the recruitment. I suppose. I mean, it's just my guess.
Okay. I mean, in terms of finding out information about the job roles, I mean, I'm not sure what's on Facebook. I don't go onto Facebook, but certainly the NHS Jobs website would be your main source of finding information, or equally the website of each NHS organisation. Just sort of Google it. So say we wanted to work in, I don't know, Crowborough, that would come under Sussex Community Trust. Have a look on their website. And you'll see any of their vacancies, their training, their volunteering, but the NHS Jobs website is the main one to find the vacancies.
Thank you very much, Jane. Another question from Gillian. I think this possibly might be answered by Jill later, but anyway, here it is. Are the apprenticeships salaried?
Yes, the apprenticeships are salaried. There is a national apprenticeship salary. In the NHS, we pay a little bit more than the minimum that's required. Now, it depends how you're going to do the apprenticeship. If you're coming directly in and you actually sign up to be an apprentice, at that point when you're coming into the sector, your salary might be a little bit lower than if, for example, you're an existing member of staff, and as a way of development, somebody puts you on an apprenticeship. So, so for example, if it's myself and I wanted to do a project management apprenticeship now, the chances are my salary wouldn't change, but they would put me forward as an apprentice to do that piece of development. So it's very much where you are in the system and how you've been employed. I don't know whether that answers your question, Gillian. We're going to talk a bit about apprenticeships a bit later on, so some of that might become a bit clearer then.
Yeah. Thank you, Jane. Sarah, she says, thank you for this well-guided session. Thank you very much, Sarah. Our pleasure. I have transferable skills in different IT and currently working as teacher, I'm taking an MSc in Child and Adolescents Mental Health Wellbeing course at the moment. My interest is to get a job in the NHS to support CYP and family, and I'm 54.
Hello, Sarah. Thank you for your kind comments. I think actually doing the MSc that you're doing, I think is going to be very good for you going forward. One of the key things that the government are investing in at the moment is young people's mental health. I think with COVID, a lot of people have been adversely affected with their mental health. So there will be lots of initiatives coming up. I would recommend that you look at the Sussex Health and Care Partnership website, that covers the whole of Sussex. There'll be some key information on there, and you'll get an idea of some of the sort of the job roles that might be open to you when you've got your qualification. But in the immediate term, if perhaps you were looking to sort of move over to that sector now, there might be some roles that would support your qualification in terms of giving you some extra knowledge. But I don't know whether that's what you wanted to do. But actually, yeah, I think you're in a really good position, and I think there'll be a lot of investment in mental health going forward, especially for the young people. And that's whether you wanted to work in the NHS or within sort of social care. There'll be lots of health and well-being sort of roles coming up. So hopefully that's helpful.
Thank you, Jane. Juliana, hi Jane. The jobs on the NHS websites requires training and I have no experience.
Okay, hello Juliana. It depends what kind of role that you want, but don't be put off if they're asking for training. Usually with the job roles, there'll be essential and desirable criteria for you to apply for a job. In an ideal world, everybody would have everything they're asking for. Quite often they haven't, and we take the best people that apply, so they may not necessarily have everything that we're asking for. And if we get the right person coming in, if you're one of those people that's got the values that we're looking for, then we're going to invest in people. We're going to invest in you. We're going to want you to come and work for us. So the key thing for you would be to sort of really make a really good supporting statement when you do your application form, and think about your transferable skills. You'll have acquired a lot of skills that you probably just take for granted. I don't know where you've been working in the past, or what you've been doing. If you've been caring for somebody and an unpaid role, you have got an incredible amount of skills just to do that. You've got commitment, you'll have good communication skills. So think about all those transferable skills. So okay, you haven't got the formal qualifications that they may be asking for, but you could demonstrate in your supporting statement what you've got that makes you a really good candidate for that role. So don't be put off if you haven't got exactly what they're asking for, and we can train you. You'll see later we have a big training budget, so we can support you with that. Okay.
Thank you, Jane. And I think this also might answer next question from Harvey. Hi, could you please let me know what the position is for people applying for a job if you have dyslexia and not having qualifications, but a lot of experience?
Hello, Harvey. Yeah, don't be put off by that. I mean, I've got a colleague working at a very senior level with dyslexia. It's not the barrier that you think it might be. We can make reasonable adjustments. There's lots of things that we can do. The transferable skills, as I've just said, are really important. And again, it'll be about demonstrating that in your supporting statement. And also, there might be an opportunity to phone the person that's actually put the advert in and having a chat with them before you put your application in. So yeah, I wouldn't be put off by that. Okay, and if you've got transferable skills, as I've just said to Juliana, it can actually be to your advantage. You've got those transferable skills that you can actually make you a very, very good candidate. So please don't be put off by that. Thank you.
Thank you. Two more questions. One from Gaynor, who says, now in my late 50s, I'm a former financial services manager in the city, and more recently, a now retired professional airline pilot. I looked into doing nursing a few months ago, but was put off because I only have 2 A levels, and I wouldn't be accepted without having to do a foundation course, which makes the course almost as long as what I would have left to retirement. I'm clearly capable, but my long ago formal qualification seems to be a barrier. Is the NHS now more flexible? Digital applications chuck you out without the baseline qualifications.
Okay, so for nursing, I mean, there's sort of a couple of routes now into nursing, and you know, like the A-level route and going directly to university. For some people, I mean, even with all your qualifications, potentially that might be a barrier. You know, you've got a lot there, so it would be a shame if that was a barrier. But if it is, there are other routes into nursing, and just to give you an idea, we've got an apprenticeship now into nursing. So whereas you'd be employed by a local organisation, and they would pay for your qualification, they'd pay for your apprenticeship for you. So typically that takes, it depends, you know, you might not have to do the full 4 years, that you might get some accreditation for prior learning. I don't know without sort of having a bit more detail, but actually, you know, there are other ways of getting to where you want to be. We've also got a role that might be of interest to you as a nursing associate, which this sits between a healthcare support worker and a registered nurse, and it's a 2-year foundation degree. Can be done as an apprenticeship, so you wouldn't have to go directly to university and pay your fees. That would all be done for you, and you'd get a university qualification. The key thing about that particular qualification is it's registered with the Nursing and Midwifery Council. So you can actually use that as a stepping stone to becoming a registered nurse if that's what you'd like to do. But equally, we do need nursing associates, and they can work across health and social care and develop. Or you could think about perhaps going into one of the therapies. I mean, with your skill set, I'm just thinking about radiography, where we've got those shortages. You're obviously good at science, and if you know you've got the pilot's qualification, or perhaps that might be an area that you might want to investigate as well. So just a couple of thoughts there. Thank you.
Thank you, Jane. We have Daniela, who is asking, I've just finished level 3 in counseling and a deep in psychology. Is there a need? I really want to get into mental health.
There is absolutely a need. As I said earlier, you know, there is going to be a lot of investment in mental health because of what we've all gone through with the pandemic. Again, I'd advise you to have a look on Sussex Partnerships website. Have a look at some of the roles of the people that work there. Also do a an NHS Job search for Sussex Partnerships. See what kind of roles are coming up and where your qualifications fit. I mean, counselling is going to be key. I mean, even working in a school as a counsellor, I mean, there's going to be a demand for that. There's, you know, schools will be investing in people's mental health as well. I've actually got a colleague that's working with a school looking after the students' mental health, but equally the teachers' mental health. So some of those roles are developing as well. So I think with your skills at the moment, got a very, very good skill set that could take you forward. So yeah, definitely have a look at Sussex Partnership as a starting point on their trust.
Thank you, Jane and Daniela. Jane, are you okay? I've got 2 more questions, but if you just let me know whether you want to answer.
That's fine. We'll take another 2, Gaetano. Yeah.
Okay. So Linda says, thank you very much for the help and great webinar. Thank you, Linda. And the question is, I have 30 years PA admin in global industry with charity and volunteering as hydro for the cerebral palsy. When applying for roles on the site, I was told by education when, from, to, etc. And if you didn't fill in, it wouldn't let you continue. Is there a person or online window chat you could talk to help you fill in?
Okay, Linda, thank you very much for your comments about the webinar. So with your experience, I would imagine that, you know, you'd be snapped up. It is that application process, I think, that could be a stumbling block. If you haven't got, I'm not sure what your qualifications are, and it's obviously something with the application form, but if there's a contact email or a contact number for any of the jobs that you're looking for, I would recommend that you give them a call or email them, and then perhaps you can start that conversation with the person that's sort of looking for somebody to work in their team. That would be my first recommendation. And the other thing I would just say to you is about, with all your experience, I'm just thinking about the vaccination program. We need people to, do admin. So you'd be very much in demand in the sector. And if you can think back some of those jobs I showed you, there are some admin roles there. There was one for a personal assistant. So I would sort of think about how you word your personal statement, your supporting statement, to really sort of sell the skills that you've got and how you could be an asset to that particular organisation. At the end, I'm going to give an email address. So if you wanted to sort of contact me later on, and we can have a chat about it, and I can give you some advice. But I think that's all I can say to you at the moment without knowing a bit more about your background. But hopefully that's a help. Thank you.
Thank you, Jane. And the last question for this Q&A session is, hi, from Reese. I'd like to ask if I can try before I decide where I want to work, like a work trail. I worked before for learning disabilities NHS home.
Okay, hello Reese. You can ask for, in normal times, you can ask for some work experience. That's a bit trickier at the moment. One way that you might want to think about is actually joining one of the trust's staff banks and just trying out a few areas there, because that can give you, I know as a nurse, if I worked on the bank, I would try several wards and then pick the one I like best and then apply for a post on there. So that might be the way to go on that. Perhaps get some work on a bank and then just have a look and see where you perhaps would like to work. When we can offer face-to-face work experience again, I know Sussex Community Trust, they do offer work experience to all age groups, not just sort of school leavers and college students. So that might be something to think about. And hopefully we're getting back to some kind of normality, so it might not be that long before you can do that. Okay, thank you.
Thank you very much, Jane. So there is another one. Let's answer this from Cheryl. I have been a bank phlebotomist, but not worked in the last year. What work can I do, please? Thank you, Cheryl.
Hello, Cheryl. So as a bank phlebotomist, if you there was that post I said earlier, that was, I'm not sure where you live, but Brighton and Sussex University Hospitals, they were looking for a phlebotomist. With your skill set, you've got lots of transferable skills there, because you could potentially work in the laboratory. You could potentially work as a healthcare support worker. So it's just, you could even have a look at one of those career quizzes or quick career mappers and just see where your skill set takes you, and give you some ideas of some other areas that you could work in. Look, perhaps I had a query the other day that somebody wanted to work as a phlebotomist, and they were saying that there's a big demand in the community. This was East Sussex, and we were sort of trying to work out why they weren't advertising, and it's the end of the financial year. So we're hoping that sort of come the end of March, you'll start to see more jobs advertised, because people will have their, teams will have their budgets then and be starting to think about how to develop their teams. So I would just keep an eye open, but you have got a lot of skills there, just from what you've done as a phlebotomist, that you could use in other areas as well. Think about also like the radiology, you could be involved in giving some, taking bloods in that area as well. Lots of other departments would want your skill set. Hopefully that's helpful, Cheryl.
Okay, so we are fine with the questions on the first session or Q&As. Now it's entirely up to you, Jane, to... Okay,
thank you, Gaetano. If we carry on to the care sector then, and then we'll have a 10-minute break at the end of that. So I just wanted to give you the other side of the sector. So we've looked at health, so we look at care now. So thinking about what social care is, it's really about looking after people in their own environment, whether that's in their own home, whether it's a care home, nursing home, so out of hospital care. We talk about something called activities of daily living. Now, these are activities that we all do when we're fit and well and just take for granted. So as an example, when we wake up in the morning, hopefully most of us can get ourselves out of bed, go and wash, go to the loo, get yourself a drink, get yourself ready for the day. So there are activities of daily living. Some people, for whatever reason, aren't necessarily able to do that without full assistance or some assistance. perhaps somebody that isn't able to see might need some support to prepare their food. So social care is more about the social aspects of someone's life as opposed to the health part. Okay, so this is about people living in the community, and it's giving some kind of practical and personal support to help people get on with their lives, get on with what everybody wants to do, very simply. Now, we've had some myths about working in the sector, especially just recently, and I did sort of allude to this a little bit earlier in the fact that there was a lot of negative publicity about the care sector not having the correct PPE. Well, a year down the line, a lot of work has gone into that. The care sector's got everything they need. The staff are being tested, the residents are being tested in care homes, nursing homes, and people are being supported in their own home with staff going in with the correct PPE. So hopefully that has all been taken, well, it has been taken care of now. And similarly to the NHS, and similarly to some of the things that we found with our survey with restless members, is that people don't necessarily think they've got the right qualifications to come into the sector, and don't think they're sort of be of any use. But just like the NHS, that's not the case. People will have transferable skills that can be used in the sector. And as I said earlier, we've got this recruitment campaign that started now to get people to think about coming into the care sector. So you'd be very welcome if you wanted to come in and try some roles in the sector. I'll just sort of say to you also, this part of the presentation, because I haven't worked in social care. One of my colleagues at Skill for Care, which is one of the sectors which is the main sector that deals with social care, gave me this presentation. So they put it together based on some of the myths and people's perceptions about the care sector. So. And they've done this after a lot of research into why people perhaps aren't considering coming to work in social care. So one of the perceptions was it's all about working with old people, and that seemed to be a concern for some people. Actually, in terms of working with older people, a lot of people like that anyway, and they become specialists in nursing and looking after older people. So it is a myth. And as I say, some people do like it. The thing with social care is it's just like the NHS. You're looking after your local population. So everybody that makes up your population, all the age groups, all the sort of backgrounds are going to be represented in social care, just like they are in health. So we're going to come across older people. And thinking about where we live, we have got an older population. So we will come across older people inevitably. We're living longer. People will need to be cared for in their homes or in somewhere like home. We will have young adults, people with physical disabilities and learning disabilities, people with mental health needs. Now this might be sort of an ongoing mental health need. It could be just a temporary need. So for example, you could have a young mum that has postnatal depression and just needs some support with her family in the interim, and to get her back on her feet and starting to feel well again, to look after her family. So it can be sort of something like that. It hasn't necessarily got to be just older people's mental health. People with sensory impairments, now that can be a young person. You could have somebody that was, born blind and just needs a little bit of support, perhaps with going out. People with drug and alcohol dependencies, and again, that can be any age. And then people receiving end-of-life care that don't wish to go into a hospice, aren't necessarily appropriate to go into a hospital, into an acute setting, want to be looked after at home. So very representative of our communities generally, just like the NHS. I think one of the things to sort of say is that it can be fun. And if you think about your activities of living, there's an entertainment, the social side of our lives. Okay, that's been a bit curtailed. I'm so sorry, my phone. Another pitfall of working from home. So people would want some perhaps help to go out for the day, do some of the nice things. Could be going to the library with somebody. It could be taking them to a theme park. It could be taking them swimming. So a whole range of different activities. So just to think about the number of people that are actually working in adult social care at the moment, I don't know about you, but unsurprisingly, it's similar to the NHS, approximately 1.62 million people and they need more people to come into the sector. So if you look at health and social care together, we've got over 3 million staff between us. There's an incredible sector to work in. And they reckon by 2035, we're actually going to need 2.4 million staff working in adult social care to cope with the demand. So, a huge workforce. And if you're thinking about it as a sort of a potential for work and a career, there is enormous potential if they need that many people. Thinking about the pay, poor pay in social care. I think in health and care, to be fair, a lot of people don't go into it for the money. It's not brilliant pay. If you look at the pay scales of, the Agenda for Change pay scales and social care, I think it's a little bit higher as a starting salary, but there is the potential to actually work your way up. So, for example, somebody coming in as a support worker could develop via an apprenticeship route and become a registered manager. And then the salaries, becomes a lot better then. But so, the pay, it isn't as poor as perhaps some people think. But I think importantly for a lot of people, and I think this applies probably to the NHS as well, it is more than just the money. People do it for a reason other than the money. See, money is important. And I've sort of listened to people speaking recently, and a lot of people, their priorities are changing. We've had a really long pandemic. People are reassessing the way they work, way they live. So sometimes they want something different out of life going forward. And I think this, the next few months, we'll probably see people changing direction a little bit. It may be forced because they've lost their job, because they've been furloughed or been made unemployed. But actually, there can be people just changing because they want something different. So it is more than just the money. I think the job satisfaction part of it is important, and I think that goes for the NHS as well. People get a sense of achievement from knowing that they're actually helping other people. And that was something that was really evident to me. I got involved with the recruitment for people wanting to do the vaccination work for the national mass vaccination. And not one person I interviewed asked me about the money. They just wanted to do it to help. So some people thought they were just volunteering and were quite surprised when they knew they were going to get paid to be part of it. But it was that just that sort of sense of job satisfaction and wanting to help other people that was their driving force, trying to make a difference, which I thought was absolutely great. So the other thing is that the myths about the hours, that they're really unsocial. Well, they're no more unsocial than working in the health sector. We do need, just like the health sector, 24/7, 7 days a week. And it's very important that all those sort of areas are covered. But there is that flexibility. So you may want to do nights. That could be your choice to do it. It may fit in with your family commitments. I mean, I did nights for years, so I was always around for my children during the day, but I went to work at night, and that suited me. There's shift work. There is some 9 to 5 work, but that sort of flexibility is quite appealing. And some people like it. It gives people the opportunity to do other things as well, that they haven't necessarily got to sort of work, full time. They could work part time flexibly. And I think it was if you look at that survey they mentioned here, that the flexibility was the second most chosen reason after enjoying working with people, that was a driver for them to work in the sector. Another perception is that social care, adult social care, is a job for women of a certain age. Again, another myth. It can be for anybody, really, anybody that wants to work in the sector. Very much like the NHS, there's an ageing workforce, and I think one of the concerns is that we've got a lot of people coming up to retirement age in the next 5 and 10 years, and we do need a pipeline of people coming through. So it doesn't necessarily have to be, school leavers. We want a whole range of people. Thinking about those life skills that people have, those transferable skills, they're just as important to this sector as to the health sector. The other perception is it is just about the sort of the care side of the role. It is where you wipe bottoms and feed people. Obviously, that is an activity of living. People need that. That's a basic need. And it doesn't necessarily mean that you'll be doing that all the time. And there's a whole range of different roles. And if you look at some of these areas here, again, you start to see a range of roles developing. We have occupational therapists in social care, physios, we do have chefs, we have HR teams, we have training teams, a whole range of different people that support the workforce. So it isn't just about the personal care side of it, which I think is, that can put people off. It's not a reason not to come in the sector, because there are other things that you could do. Some people think it's a dead-end job, and there is this sort of, the NHS is a better place to work and social care isn't quite so good. That really isn't so. And as I said, we're working in an integrated care system. We are dependent on care, as care is dependent on health. So there is a lot of training. So some people might come into the sector without very many qualifications relevant to that sector. They will bring with them a whole range of other skills, and there is lots of training right from the beginning. So typically, and this would be the same in the NHS, you'd have an induction. So there'd be a trust induction in the NHS, there'd be an induction in social care, whichever role you're doing. If you're involved in care, then you'll be asked to complete the care certificate. And that's based on sort of 15 standards. So it's things like safeguarding, it would be basic life support, it would be communication, a whole range of standards to support your induction into the sector. And then once you've done that, you can start to sort of map where you'd like to go. Now, just as an example, if you complete the care certificate, that is one of the requirements of some of the care apprenticeships. To actually complete it, having done the care certificate. So if you come in and you do your induction and do the care certificate, already you're on a bit of a pathway, and that you can start to develop your career if that's what you'd like to do. So there are other other roles that you could start to consider then. So you could sort of come in as a care worker, but then progress to a senior care worker, and then work your way up to a manager, or perhaps you might want to think about being a social worker, a registered nurse, or one of the therapy roles, allied health therapist. So there's lots to sort of think about, really. So thinking about why you should work in social care, I think one of the key things for me is, it's probably a bit like the NHS, is that there's lots of different things that you could do, and you might start off in one area. So you could come into either sector, perhaps in an admin role, and then you might decide to go into a clinical role and then progress your career. So there's those opportunities which I think are really, really important. The other thing that's got right in the middle there is it's recession proof. Now, if you look at the sort of the stats I showed you about the sort of the sector increasing and the needs of the sector, you're always going to have a job within this area if that's what you'd like to do. Okay. There are career progression opportunities. People do get some job satisfaction. I mean, as a nurse, certainly working in the health sector, I found that one of the nicest feelings in the world is when you've done something for somebody and you've really made a difference. And it might be something really small that you've done, but you've made a difference to that individual. And, you can't bottle that. It's such an amazing feeling, and that would be the same in the care sector as well, that feeling that you've actually done something to make a difference. So if you wanted more information, the Skills for Care website has got a lot of information, just like the NHS pages. There's all kinds of things that you can do on there. You can do the quiz to see whether you've got what it takes to work in the sector. There'll be give you an idea of sort of case studies and how you could develop your career. Different roles to give you some idea of some of the search terms that you could use if you're looking for jobs. And the jobs here would be advertised in a range of places. So they might be, you might see them in your job centre, you might see them on Indeed, you might just see a local care home asking for some people to sort of apply for different types of roles. There's a whole range of ways. So you probably have to do a little bit of research to find the role that you're looking for in this sector. But if you have a look at that portal, the current recruitment campaign, you'd be able to sort of pick up some jobs there. Also, just to say to you, in West Sussex, there's the Proud to Care campaign as well, and there's lots of links on their website for different job roles. And I've put together a flyer, and I say you'll get this as part of the presentation when it goes out to you, and you'll be able to have a look at some of the websites on there. Okay, and I've put one up for the, I've got one also for the NHS site as well, some of the things that you might find useful. Okay, so I don't know whether I've got any questions, Gaetano, and then we can have a break for a coffee.
Thank you, Jane. There are no questions for the time being, so let's have a break. And I just want to remind everybody that, as Jane said at the very beginning, the housekeeping summary, don't worry about taking notes. I mean, you are more than welcome to do that, but you will all receive a thank you very much email at some point after the webinar, either today or tomorrow, and also the recording of the session. So you are free to go through the whole webinar again at your own leisure and find information that you might not have written down. Okay.
Thank you.
The next question from Emily. My previous employer is the prison service and they won't write personal references. It has to go through their shared services company. They tell managers that they are not permitted to give reference on behalf of HM prisons. Consequently, there isn't a named person or telephone number to contact, which the application forms require. It's the only thing to do to call the contact on the job advert to see if there is a way around it, or do you have advice on that, please?
No, I think it would be, if there is somebody named on the advert, I would contact them. The only other thing I would advise that you could potentially do is to, via their website, speak to somebody in their HR department and take advice directly from them. That they must come across this. They must come across areas where they just can't get references for whatever reason, and they'll be able to advise you as to what that particular trust does, what their policy is towards that. I mean, I think that would be my best advice to you. Thank you, Emily.
Thank you very much, Jane. And then we have Karen, but there is no question from you, Karen. So maybe you want to type it, and then we can ask Jane your question. Thank you. Another question, don't have the name of the person, sorry. Is there a definite retirement age with the NHS, or can you continue beyond in the non-clinical areas?
Yeah, you can. Yeah, there isn't a particular age anymore. I've actually had a colleague that was into her 70s working in an admin role within an HR department. So yeah, there isn't a specific retirement age. A lot of people, especially if they've got an NHS pension, so some of the clinical staff can retire at 55. When you think, you know, most of us now can't get a state pension till we're 66. A lot of people are waiting till at least that age, but there's nothing to stop you staying on if that's what you'd like to do, and you're able to do the current job to the best of your ability. It's possible that you may get to the point where you might want something that's a bit more part-time, and that you can have those conversations with your manager, work a bit more flexibly, and have like a gradual retirement. So yeah, there's lots of options, and it's just a question of having a conversation with your manager, and they will probably involve the HR team, but there's no specific age as to which you need to retire.
Thank you, Jane. Emily says, great, thank you very much. And another comment from Linda, more than a question. The law is that a company must give you a reference, but this will only cover a confirmation that somebody worked from this date to that date.
All right, okay. That's useful to know. Yeah, thank you, Linda.
No more questions. So
Lovely.
Actually, there is one, sorry,
Okay.
from Juliana. Hi, Jane, thanks for the information so far, it's been useful. Can an employer refuse to fund an apprenticeship? There
will be a conversation. So if for example, you've got a job and you particularly wanted to do an apprenticeship, and your manager said, well, actually, it's not necessary for this role. That they could, in fairness, say, well, actually, you don't need it for this role, so we're not going to fund it. But it's more often it's that sort of conversation with you and the employer to see what you need to do your job to the best of your ability and what kind of development you would like. So there is that sort of a bit of a conversation going on as to what's best for you, what's best for the organisation in the team that you're working in. So if it was something totally inappropriate, say you were working in an admin role and you decided you wanted to do phlebotomy, for example, and they might send you off to do some training, that wouldn't be appropriate for your particular role. So it's got to be appropriate to what the area in which you're working, if that makes sense. Thank you, Juliana.
Okay, so we can pause the Q&A for the time being because I can see Jill has joined us. Nice to see you again, Jill. So please introduce yourself, and it's the stage is all yours.
Oh, thank you very much. Okay, my name's Jill Reynolds, and I'm Patient Experience Lead for Voluntary Services for East Sussex NHS. Oh, here we go. Wow, as if by magic. So my role is really to, I support a team of voluntary services coordinators who recruit, train and support volunteers in a wide range of roles within the Trust. And we always encourage people to think about coming in to volunteer just to get them work ready, new opportunities, possibly consider a career pathway within a healthcare setting or within a trust for us. So we'd encourage people to think about this, and I think that's why I'm on this call, because my understanding is that this is really about new career pathways for people who are thinking about what they want to do. I just want to mention a few of the roles that we have. At the moment, we've got meet and greet at Eastbourne District General Hospital, and that's working in pairs to welcome people, whether it's patients or visitors, also staff, as they're walking through reception and signposting them to where they need to go. Having that welcome face has been so important. Our volunteers really improve our patients' experience of the Trust, and they're very, very important to us and highly valued. We've had quite a high number of volunteers supporting our vaccination hubs in recent months. Although we're on a bit of a go slow at the moment, that's going to pick up again in the next week or two. And on both sites, at the Conquest Hospital as well as Eastbourne, we have up to 30 volunteers helping out with the vaccination clinics. So, and they're all put on a rota. So, for example, our volunteers, we ask them to commit to a minimum of 4 hours per week, each week. So it's not excessive. What we find is that some volunteers who really enjoy their role, they come in more than once a week, and sometimes they double up on doing different roles as well. Recently, we've introduced our volunteers into our Discharge Lounges, and that's a really lovely role where our volunteers can have a chat to people who are being discharged that day, check in how they're doing, cups of tea or coffee, light lunches, generally having that nice friendly chat, and being curious about what support they've got at home, which could, again, will enhance their experience of being returned home. I think I'll leave it there. We've also got gardeners, so they're not all patient-facing roles. And we're very interested if a volunteer is keen to consider a career pathway, how we can ensure that they're getting the right training and support in the right kind of role, or a range of roles. We're very keen to continue to recruit young people into the Trust as well, and ensure that they have a very good positive experience of volunteering for us. I think I'm going to stop talking and go over to Jayne. Do you want to add anything? I mean, I think you said quite a lot already, haven't you?
Yeah, we were sort of looking at sort of the ways in, and you just mentioned about volunteering could potentially be a way in for people perhaps that are thinking about changing their careers. Yeah. They might have had a career break, they might have recently become unemployed. Yeah. So it's quite a good time to perhaps consider volunteering. And it can lead to something else, can't it?
Yes, and also obviously if you're volunteering over a period of time, we can provide references which can be helpful. I think also in the current climate, just getting out the house and doing something different and engaging with people and having conversations and feeling part of a team and reconnecting with generally can really build someone's self-confidence back up. You know, just the routine of getting up, getting dressed, being ready, going out, doing something different for the day, and then going back home again. It's about rebuilding people's confidence as well, self-confidence.
I think the point you just mentioned, Jill, also about being able to offer a reference for somebody that has volunteered for a little while could be quite important. We've had a couple of people to say they've been self-employed for a few years, and if they, you know, who could they ask for a reference if it's been a little while since they've had an employer? So that could be really useful, couldn't it?
Oh, absolutely. Definitely. And also we're very interested to hear that, you know, individual requests saying they're particularly interested in a particular department or want to have more experience in a particular role. Where possible, we try and develop those opportunities when volunteers are specific about something. Because what we're noticing is, and what I'm delighted about, is that increasing number of volunteers are coming in with such great work experience, confidence, communication skills, new skills that we're really pleased to have, and a real asset. We see our volunteers as a real asset to the trust. Yeah. Any questions?
Any questions? Sorry.
Yeah, sorry. I was just. There are questions. Yes, indeed. So I wasn't. I didn't want to step in and interrupt you. So, Linda says, "Hi, Jill. May cover this, but do you have to go through the hours filling in the NHS job site just to volunteer?"
No, you just come directly to us, and you will be given an information sheet after this presentation, after today, which it gives you the details of who to contact and how to contact our voluntary services teams, either in Eastbourne or in Hastings. And then we'll take you through the recruitment process, which is fairly straightforward and takes up to 2 to 4 weeks from initial inquiry to being an active volunteer. I mean, if you've got a ready-made DBS, that's fantastic because that will fast track you a bit more. So yeah, it's a fairly straightforward process.
Thank you very much, Jill. Another question for you from Angela. Where can you find out exactly what volunteer roles are available?
Well, the information sheet that you're going to be given has got sort of a number of roles named on that sheet. So you can also look at our website. It's generally opportunities, volunteering opportunities can change all the time. But at the moment, we've got the steady ones, which are meet and greet, discharge lounge, vaccination hub, and then a few going on to some wards where it's safe to do so. We also got openings for gardeners. If you fancy doing some gardening, particularly at Hastings, we've got these wonderful courtyards within the hospital grounds, and anybody who's keen to help out there, well, that would be fantastic.
Thank you. So we have the same question both from Lucy and Daniela. They would like to know whether there are any volunteer opportunities in West Sussex area and who could I contact for volunteering opportunities over there?
Okay, yes, absolutely, there will be. All trusts really value their volunteers, so there'll be a very similar process in place for West Sussex NHS Healthcare Trust. So if you just Google that or go on find their website, you'll find out what opportunities there are for volunteers there. Equally, you may want to look at an organisation called Community Works, which are based in Adur and Worthing, and they have a wide range of volunteer roles in the community that you may be interested in as well.
Thank you. Linda, again, she's asking whether there is a contact for Haywards Heath, Horsham.
Yes, that'll be. I think that could be Sussex Community Foundation Trust. Again, Sussex Community Foundation Trust do have extensive opportunities for volunteers. So it'd be worthwhile you contacting them in the first instance. But for Haywards Heath, I think that's where the Princess Royal is. And there may be opportunities through Brighton Sussex University Hospitals Trust. They're the trust that have run the Princess Royal in Haywards Heath.
Thank you. One last question about volunteering, and then there are more about more general questions related to the webinar. So Cheryl is asking, she would like to have an address for the Sash area of volunteers.
The South area.
That's I think Sussex Community. That comes under their remit. And also, if you went onto the SASH website, Sussex and Surrey Hospitals Trust.
Yeah.
If you have a look on there, but I know Sussex Community, they also have some rooms there, and also Sussex Partnership, the Mental Health Trust. They've also got rooms in that area as well. So
yeah. All trusts use volunteers and welcome volunteers. So, and there's a huge wide range of opportunities for volunteering. So definitely have a look.
Thank you both. Daniela now is asking, I'm 51 and wonder, is age concern? Is the pattern shifting to your skills rather than age?
It's not age specific. It's about your skills, experience. Ultimately, it's your enthusiasm. So if you're keen and you're willing and you want to do something to support your local trust in a volunteering capacity, we would welcome you. And we our age range is, I would say, 16 to 85 to 90. So yes.
Then we have a comment from Emily saying that a quick point for the person who was asking about bursaries for training. If that person is interested in nursing or an AHP role or similar, they are likely to be able to access the student loan system, even if they already have a degree, and that funding only has to be paid back as long as you are working. So that's a recommendation from Emily.
That's good.
Thank you, Emily.
Yeah.
And then Gillian, question, if the interview is conducted online, what are your tips for demonstrating yourself in the best way?
Oh gosh. It's like any Zoom situation. We don't really do it. We sometimes do interviews online, but we're generally over the phone. We take our volunteers through the recruitment process. And so it's not a really formal interview. It's generally we really don't turn anyone away. But top tips is maybe not have a busy background like mine. Look in the mirror before you go on a Zoom.
Yeah, do that.
See, I didn't do any of that today, so don't look at me for example.
Can
I just add to that? I was told recently, if you're going to go for an interview and it's a Zoom interview, not so much a telephone one, is to make sure that your top half looks quite smart. Yeah. Not necessarily all jackets and everything, but just look smart and well presented, because it is still an interview. And Jill's point about the background as well. Try to keep it as professional as possible. If you can have like a plain wall behind you, just general things that you probably do anyway for an interview. Just think about that. And for example, if I'm doing something that quite formally, even though I'm working from home, I have to wear my shoes. It just puts me in that frame of mind. So get yourself in interview mode. Yeah.
I tend to agree. It's psychological. They do, do say sort of, even though you might not, getting up, getting dressed and putting some makeup on and making yourself look nice for the day, even though you may not see many people who just go to the local shop, it generally gives you a feeling of, I suppose, bon vivant, really.
Yeah, you're absolutely correct, both of you. If I can add, I've done a couple of interviews myself over the past few months, and by Zoom, Skype, Google. And what helps, if I can suggest, is to actually research on the company you're applying for, see what their culture is, and based on that, you might see, okay, I need to wear a tie as opposed to being a bit like more informal or smart, casual. That helps a lot.
Yeah, and I think the important thing is you feel relaxed and confident. And I think it's always useful to obviously get that information about the organisation of the service and find out what their values are. Increasingly, values are very important. So if you have a think about how you can demonstrate those values and why you agree to share the values, is really good. A really good thing to do.
A follow-up from Lucy to her question regarding the volunteering opportunities. She's wondering who pays for the DBS check for the volunteering works.
We do. We cover DBS costs. We also cover volunteers' expenses. So for travel expenses, and if our volunteers are doing more than 4 to 5 hours in a day, then we would cover the cost for lunch or snack up to £5. So essentially, we don't want our volunteers to be out of pocket as a result of volunteering for us.
Thank you. We seem to have run out of questions.
Okay.
For now.
Okay.
Thank you. Thank you, Jill, for your time.
Oh, my pleasure. Yeah, no, it's always a pleasure. I can't see everybody, so I don't know who I'm talking to, but it's really yeah, it's always lovely to kind of contribute to the events like this. And so I just want to say, if I say cheerio now, you do have the information, don't you, to send? Shall I resend it?
I think we have it, and it will be added to. Yeah, that's okay, Jill.
Yeah, it just gives it gives examples of the kind of roles we've got and who to contact for our volunteers for recruitment. And so I'd say, well, thank you all for listening, and I'll say cheerio for now. I think that's it.
Yeah, actually, before you go, there is another question.
Okay.
Sorry, from Linda. If you already have a DBS in place for hydrotherapy, do you need to have another one?
No. One DBS is sufficient as long as it's less than 3 years old. That's fine. That's really good. So it's great. We just need to see the number. You have a kind of reference number for it, and that's all we need to see. So yeah, it's always good.
Actually, Jill, I've got a question. In terms of the volunteers, do they have to have a kind of uniform, like a sweatshirt or anything like that, or a polo shirt?
Well, that's very timely. We go for smart casual. We do offer. We've got these kind of bright orange fleeces, and now don't let that put you off. They are a bit EasyJet, and I'm looking to change them and checking with our volunteers what they would like to wear, because there's other trusts have got some lovely uniforms for their volunteers, including there's a lovely, I don't know, purple polo necks with volunteers written on the side. So we're looking to improve that, but we'll always involve our volunteers in decisions like that going forward. So I'd like to see by early summer us having some new type of uniforms. But yes, we would always provide our volunteers in particular roles with the right kind of wear, and obviously PPE is very relevant as well. Where it's needed, we provide PPE as well.
Thank you.
Oh, thank you. Good question. Yeah.
Okay. Now, I suppose we are at the. I don't know. It's entirely up to you, Jayne, to continue, or I'll leave it up to you. Yes.
Okay, I mean, I'm happy to continue unless people would like a break, a 5-minute break. What do you think?
I mean, it's 10 to 12, so I don't know. It's do you want 5 minutes or another 10 minutes? Based on, I suppose the next one is going to be the last section of the webinar, so it's entirely up to you to take as long as you like for the break, 5-10 minutes. Or
should we take 5 and then we've got plenty of time for questions after that next bit? Thank you, Gaetano. Welcome back, everybody. This is the last part of the webinar. I wanted to talk to you about the education and training in the NHS, and then also I've got a bit of time then for any questions that you might have. So within the NHS, specifically, we are really, really keen to ensure that all our staff have up-to-date knowledge and competencies to actually give the best service possible to all of our patients. Health Education England, who are an arm's length body, and they sort of deliver the mandate from the Department of Health. They talk about our most important resource is our people, and consequently there's an enormous amount of investment in our training and education. And they say that without a skilled workforce, there is no NHS, and each and every one can make a difference to patients. So it's all about the patients, no matter where you work in the sector, whether it's in a laboratory, whether it's frontline services, whether it's in an office. People are all offered the training. It's mandatory training, but everybody's offered the some training to make sure that we do things to the best of our ability. And just to sort of say to you that, I've worked in the NHS probably 40, I think, best part of 40 years, and I have never had to pay for any of my training and education, and I've had a lot of education. All my qualifications have been paid for by the NHS, and I've been supported by my employers. So as an employer and looking after the staff, I think that's one of the very, very strong parts of the system, and it doesn't matter what age you are, there's constant development. So immediately somebody comes to work in the NHS, they've been successful, you've got your interview sorted, you've got through that, been offered the job, straight away there'd be a trust induction, whichever organisation it is you work for. And thinking about the NHS quite broadly, we've got GP practices, we've got health centres, we've got our big trusts across Sussex. They'll all have a slightly different focus. So, for example, we have got a mental health trust, we've got the ambulance trust. Sussex Community Trust is what it's a community trust. So it's got lots of the smaller satellite hospitals, Lewes, Crowborough, Uckfield. It's got satellites in Worthing, Chichester. So Sussex Partnership is across the whole of Sussex. And then you've got the Brighton Hospitals Trust, Brighton Sussex University Hospitals. It's got the Princess Royal. We've got East Grinstead Hospital. And we've got East Sussex Healthcare Trust and Western Sussex Trust. So all those organisations are invested in supporting their employees to give the best possible service. As you know, we're sort of continuously monitored by the CQC. We have to have our staff trained and competent. It is a requirement. So you have your induction, and there'll be some statutory and mandatory training, so health and safety training, things like safeguarding, GDPR. So make sure that you've got all the information you need to do your job as best you can. They'll talk about the trust values. You'll be given information about health and well-being, and I think again this is something that the NHS it has done very well in the past and is doing even better in the current situation with the pandemic. It's very aware that it needs to look after the health and well-being of its staff. If you think about, the NHS, its people are its main resource. People need to be kept fit and well. So there's a lot of support in terms of mental health at the moment, and making sure that staff, if they are struggling to cope, that they get the support they need. Also working in the NHS, you get a bit of a cushion really, because if you're a contracted staff and you are unwell, there is some sort of sick pay once you've got through the sort of qualifying period. So if you have a period of illness, you have got a bit of a cushion, which I think is something that's really quite supportive. If you need a procedure and you need some time off work, or you're unwell. So in terms of the health and well-being, there'll be an occupational health department, and there'll be staff within there that can offer counselling, and things like counselling are offered free to staff, and you can self-refer. Additionally, there'll be a local induction. So you've got an overview of the trust and their expectations of you as an employee. I also sort of mentioned at that point, you'd also perhaps get to meet staff side, like the unions and people like that. So you have an overview of all the structure of that particular organisation. The local induction will be very much about your department, meeting your colleagues, your manager, and sort of having a look around the department, making sure that you're familiar with it. And it depends what kind of role you have, but there could be a supernumerary period. So in some areas it might be, a week of your first week in the organisation is supernumerary. So you're doing all those initial things to get to know how things are done in that department, and then the following week you start work as normal. You'll get information about policies, which policies are specific to your department, and although people will ask you to read them, they don't expect you to remember every single thing, but all the policies will be accessed on the local intranet. So each organisation will have their own system, their own website with all this information that you can follow up. If you're going into a clinical role and you're perhaps going in at the support worker level, you would be asked to do the care certificate. And this is a really good starting point, and it will give you a really good grounding in the kind of things that you need to be aware of. So it'll be about safeguarding, it'll be infection control. So it's 15 standards, and once you've done that and you've completed it and people have seen you sort of working in practice, once you've achieved that care certificate, it's like a platform from which you can go off and do some other training. Now, some trusts ask for the care certificate to be completed along with something called like a numeracy challenge. Part of the apprenticeships, which I'll go on to talk about in a minute, is that you have a level of maths and English knowledge to actually achieve that apprenticeship. So right from the beginning of when you first join that particular organisation, they're supporting you with your maths, making sure you're at a level that you can actually complete the apprenticeship. So your learning journey starts at that point from your induction, and then it builds on it. Additionally, we have annual mandatory training. So first year, enter your first year, you'll be expected to do, might be some e-learning, it might be some face-to-face training. As I say, at the moment, everything's a little bit different. But normally, if you went into a clinical role, you'd be expected to do face-to-face moving and handling training, basic life support, infection control, and so on. We also have in-house educational programs. So each trust will have a training and development department, and they will design some courses for their staff, what's appropriate for their workforce, where they need those additional skills. So they'll have some in-house programs. They may buy in some training for specific things. So that there's a really good program there. So it could be something like a train the trainer program. And that can be, if you wanted to go into education, that might be a route into that sort of area. We also have in the NHS a leadership academy, and you can access some of the courses free online. There's something called the Edward Jenner program, and this is for like a first level leadership program, and you can just do that yourself. You haven't got to sort of get permission from your manager. As you go to sort of different levels, there's something called the Mary Seacole program, and I can't, off the top of my head, I can't remember the other one, or Rosalind Franklin. They're sort of for more senior leaders, and then your manager could refer you to do those. And then we've got apprenticeships. Now, apprenticeships are quite key now in education and training in the NHS. So we had National Apprenticeship a couple of weeks ago now, and you might have seen some stuff in the press about it. There was lots of promotion about apprenticeships. There are some myths around this as well. And one of the biggest myths is that they're sort of age specific. They are, in terms of the youngest age that you can do an apprenticeship is 16. There is no upper age. So in theory, you could be into your 70s and do an apprenticeship. Okay. The other thing is that, especially sort of from my age group perspective, when I was at school, people that did apprenticeships often, not solely, were people perhaps that weren't so academic and they wanted to do a more practical role. That's not the case anymore. The apprenticeships now have been written by employers to actually make them relevant for the industry that they've been written for. So, for example, all the healthcare related ones have been written by the specific healthcare professionals that are in that role. So, for example, the nursing one has had a panel of nurses developing the nursing apprenticeship, and all the sort of healthcare support workers, nursing associate. The radiography one would have been by radiographers, so that they are totally relevant to that particular profession. So it gives them a lot of kudos, and they're highly recommended and well received. The other thing is that they were always considered perhaps a way of having like cheap labour. We don't pay the national minimum apprenticeship wage in the NHS. We pay on the Agenda for Change pay scales. Now, if, for example, you came in to do an apprenticeship and it was for a Band 2 post, they may, in some organisations, and there's nothing standard about this, so each organisation interprets things slightly differently, but they may pay 80% of a Band 2 at a particular level. And then when you get the qualification, they would give you the whole rate, as it were. But there's lots of different ways of doing it. They may pay you the full Agenda for Change rate, but that would be something to ask. Also, they're not just for entry-level roles. So they're not just for people coming into the sector that haven't got a particular qualification. They can be at all levels. So, for example, and I think I've mentioned this earlier, I'm a registered nurse, but if I wanted to do project management, I could actually do a project management apprenticeship, which may be below the qualifications I've already got, but actually I haven't got a qualification in project management, so it would be totally relevant, and I would get the skills I needed to achieve that apprenticeship, and then to sort of do the project management side of my role. So they, senior managers can do them. It can be used at any level within an organisation to develop staff. Evidently, there's an MBA now as an apprenticeship, which I think is quite exciting. So in terms of levels, they talk about intermediate, advanced, higher and degree. Equally, the language is around level 2, which is like a GCSE equivalent, and level 3 would be A level. And then you've got the sort of the higher levels, which is foundation degree and above. So a healthcare support worker, a business admin apprenticeship could be like a level 3. And then once somebody's got that, if they wanted to, and it was a service need, they could progress up to the next level. Now, as an example, we get lots of people doing a business admin apprenticeship and then perhaps thinking that they might want to do project management. They might want to sort of get some slightly different skills to take them up perhaps to a management level. And so they do one apprenticeship, finish it, and then do another to support their progression. So right up to degree and postgraduate level, we've got apprenticeships now, so it's quite exciting. And the key thing about this is there's no cost to the individual taking the apprenticeship. The employer will pay the cost from their apprenticeship levy. And I wanted to give you some examples of some career pathways that you could actually use an apprenticeship to get where you wanted to be. So I do nursing and admin as examples. So at the moment, if somebody would like to be a registered nurse, they have to go, the direct route would be to go to university. They'd have to have the entry requirements for that particular university, which is typically something along the lines of 3 A levels or a BTEC or an equivalent. They would do a 3-year Bachelor of Science in Nursing, and at the end of it, they'd be registered with the Nursing and Midwifery Council. They also now have to pay tuition fees via that route. If somebody perhaps hadn't got the 3 A levels, the entry requirements to university, or didn't want to go to university, there's a different pathway, and individuals can work their way through the different apprenticeship levels. So somebody without any qualifications but really, really wanted to be a nurse, and I've actually seen this done. I've seen people go through this pathway. They can become a healthcare support worker and do an apprenticeship at level 2, which will take them probably just over a year. Then they could do a level 3, which is sort of an 18-month course apprenticeship. They could apply to become a nursing associate apprenticeship. Now that is a 2-year foundation degree apprenticeship, and that would involve them having some time at university, some time in the workplace, learning the skills to become a nursing associate. And at the end of that particular qualification, they'd be registered with the Nursing and Midwifery Council, and they'd have a foundation degree in nursing. We want people to work at that level. I mentioned we haven't got as many nurses as we need in the workforce, so nursing associates working at that level are integral to our needs at the moment. And then if that individual then wanted to go on and become a registered nurse, they could step onto the degree pathway and do another 2 years and become a registered nurse. So a slightly longer route, but the advantages of that would be that it's open to anybody that shows an aptitude or a desire to be a nurse and can work at those various levels. Maths and English would be a requirement at level 2 for some of these qualifications, but support will be given. There's lots of education to support people with those qualifications. So if somebody hasn't got their Maths and English GCSE, they would be given support to get their functional skills at level 2. And the colleges often work with staff to do that. It's not uncommon. A lot of people struggle with maths, but the support is there, so that it isn't a barrier. And then once they've, at each level, they will be getting a salary. They will be under the NHS umbrella, so they'll be getting, putting towards their pension. They'll have all the benefits of working for the NHS and getting their qualification paid for. But essentially, they're getting some really useful hands-on experience. So by the time they qualify, they're actually ready to go. They're ready to get out there and do the job, which is a great advantage. And then looking at the admin pathway, again, somebody coming in with very little in the way of formal qualifications, but perhaps has other life experiences, a good people person that's had a job where they've had lots of contact with the public. They could do a customer services apprenticeship, and then think about perhaps business admin. I'm thinking about somebody perhaps working as a receptionist and then developing their career to do business admin, and then go on perhaps to lead a team, become a department manager, perhaps do a qualification from the Leadership Academy, because you're not just restricted to doing the apprenticeships. You could do a particular level, take a year out, perhaps do something from the Leadership Academy, go back onto an apprenticeship program. And previously, if somebody had a degree, they weren't able to do an apprenticeship. The rules have changed now. So if you've got a degree in another sector and you wanted to retrain and do something totally different, you can do a degree apprenticeship. So I think it opens it up quite a bit. And the allied health professions, I think that it's a really good pathway. We're desperately short of some of those allied health therapies. So again, it's a really good route in. But you can see there's lots of different pathways there, and you can tailor them. And you're not just stuck to one pathway. So somebody starting off in admin hasn't got to stay in admin. They can veer off. And I'll give you an example of this. It's my daughter. She didn't know what she wanted to do when she left school, and she got a job working on the bank, actually, in a hospital, and they put her in the payroll department. So she hadn't got any specific interest in that, but she did it for some money. But then she got offered a job, a permanent job, and then one day she just decided she wanted to be a radiographer, and she was in the right place at the right time, and the hospital at that time paid for her to do her training, and now she's a qualified radiographer. So she moved about. She didn't know what she wanted to do, started in admin, and then went into a clinical career, and that happens quite a lot, actually. So to give you an idea of some of the clinical apprenticeships, we've got over 70 at the moment that are healthcare specific. And the full list of the healthcare specific apprenticeships that are available at the moment, and this list is growing as employers write more apprenticeships, can be found on something called the HASO website, and you'll have the link for this. So it's Skills for Health. I've got a list of all the apprenticeships, and you'll be able to see what they involve. So the key thing about an apprenticeship is 80% working, doing the day job as it were, and 20% off the job training. So over a 5-day week, you'd have 4 days doing the job, and then 20% would be perhaps doing some studying, being assessed. It could be going to the library and finding out a little bit more about projects and things like that. It could be going to meetings to learn about different specialities that inform your apprenticeship. So 80% on the job working, and then 20% off the job. Doesn't mean you have a day off to go anywhere. It means that you do something different from your day job to support your qualification. And the key thing also about apprenticeship is it's a partnership. You have to be employed, so you have to have the employer, you have to have a training provider, and you have to have the apprentice who is employed. And they're the 3 components of a partnership. And the apprentice is very much looked after with an apprenticeship agreement. So you're not disadvantaged in any way, and your off-the-job training is protected. And as an employer, they'd be held to that by the training provider. And we've got a range of non-clinical apprenticeships. Now, the Institute of Apprenticeships lists all the apprenticeships that are out there at the moment. And again, you'll have the link for this, but then you can have a look through and see what kind of area that you might be interested in working and what level you'd like to work at. But I say the key thing is you have to have the job and then the apprenticeship. I just thought this might be interesting. These are staff that work across Sussex. There's a sort of, they're not straight from school, they're not straight from college. These are staff that have either come in at a later stage of their career or have worked in the NHS for a while and then done some development. So this particular person did a health and social care nursing associate apprenticeship and went to university and has really developed as a result of doing that. So that's one example. That's sort of a clinical pathway. And then this particular person, she did a business admin apprenticeship, and she sort of puts here that she hasn't got much self-confidence. Had a discussion with her line manager, and this might be part of the appraisal process. This discussion that people can have about their development, what they need, and what will suit them at that particular time of their life, and then have a plan of how they're going to achieve that. So she did business admin, and this lady here also did. She was a speech and language therapy, worked in the speech and language therapy team, but then decided to do some development to update herself. And that's another way of getting an up-to-date qualification. Within an organisation, there's a lot of celebration around getting one of these awards. Normally there's an apprenticeship awards ceremony. There might be one across Sussex, and I think we're looking at virtual ones sort of going forward, but they're always celebrated. And I think that's the nice thing about these qualifications, they're really valued. So in terms of sort of next steps, I can take some questions in a minute about the sort of the training and education. Should I do that first, Gaetano, and then I'll do the next steps? Are there any questions for me?
Yes, there are a couple of questions. We have Lucy, who is asking one question with three different facets of it. So she says, is an open university access course qualification recognized in the NHS in replacement of A-levels? Do these have an expiration date? Then she also has an American qualification as a certified nurse's aide. So she would like to know if it's recognized in the NHS. And also she has registered to do a phlebotomy course through Gateway. And she would like to know whether these would be recognized in case she will complete it.
Okay, thank you, Lucy. Thank you for your questions. So yes, I know you access courses recognised. The usual currency time for academic qualifications is 5 years. So if it's within 5 years, it would be recognised, and that's for all sort of qualifications. If you've got a qualification from another country, there is something called NARIC, and you can actually have a look on the NARIC website to see what level it's recognised at in this country. So, for example, in some countries, I can talk about the ones I know. I've interviewed people that have a BSc in another country, but when you put it through NARIC, it might be at a level 4 in this country. So it's just having a look to see what level it is. Okay, but it's worth investigating because you've already got that qualification. And then doing any courses through a private provider, which I assume Gateway is, I'd always just have an element of caution to make sure that the qualification that you're working towards is going to be recognised in the NHS. Some organisations prefer you to have done the training with them or a recognised course with them. So I would just do a little bit of research as to what organisations are looking for. That one I mentioned earlier in Brighton, they were going to train the individual themselves because they wanted a particular standard. And with some private organisations, I'm not saying that they won't be to a high standard, but it's having that recognition that standard is what the NHS wants. So I would just have an element of caution when you do anything privately, just to save you spending money that perhaps you don't need to on a course or a programme. Thank you.
Thank you, Jane. Natalie is asking, are apprenticeships available for someone wanting to work part-time?
Yes, they are, Natalie. I think you have to work up to 30 hours. I'd have to sort of look this up, but you can work part-time and do an apprenticeship, as long as you can get the qualification done. I think say it's a level 2 and you've got a year. I don't know whether they can extend it slightly if you are on part-time hours, but that's something you just have to look at. But it depends how many hours. If you're only going to do like 1 day a week, that's going to be very, very hard to do. 30 is in my head, but I without looking it up, I wouldn't know for certain. But yeah, it is possible. If you had a look on the government website for apprenticeships, they'd have a lot more information on there that you could look up. And if you were looking for a particular apprenticeship, you can actually register on the government website and see what apprenticeships are available. The NHS organisations may advertise on NHS Jobs that it's an apprenticeship. Sometimes they might put the apprenticeship in the detail, like they'll ask for certain qualifications, but say there might be a caveat that if you haven't got those qualifications, there's an expectation that you do an apprenticeship. Hopefully that's helpful.
Thank you, Jane. Gillian is more of a comment and feedback. Thank you, Jane and Jill, for such a thorough webinar. Very encouraged that such a large UK employer is providing exciting career choices for all demographics. Exciting times where everyone can move forward with their careers.
Oh, well, thank you, Jim. That's really nice of you. Thank you. Yeah, we're really excited because it's like, you know, we've got all this interest in the NHS now. We really want to sort of, you know, harness it and get people working in our sector, which will be great for us to get some new people coming in. So thank you for your comments.
There are no more questions for now. So we have another 9 minutes or so. It's up to you.
Okay. Well, I just sort of remind everybody sort of next steps. So, you know, it's really up to you what you want to do. If you found this useful, you may wish to consider, you know, applying for a job. Have a look on the NHS Job website. You know, put in a search term, see what's about, you know, in your area where you'd like to work, and equally the care sector as well. I said there's going to be some really good opportunities in that sector. We've got some information coming to you about the volunteering. Obviously, Jill spoke to you about East Sussex Healthcare Trust, but all those other NHS organisations will have a page on their website about volunteering. Perhaps some people might want to sort of access some training. I sort of said about like the like phlebotomy. I mean, there's lots of free training out there. There's lots of e-learning. The OU do lots of free courses. The local colleges offer free courses that might be quite useful to you in terms of, you know, infection control training, finding out a bit more about dementia. So if there was a particular interest you had that might actually support your application, something that you could write in your supporting statement while you're waiting to get your job, that might be something you might want to do. And then looking for an apprenticeship, you know, investigating if that's something you might consider. And it's a brilliant way of actually getting in, changing your career focus totally, and getting paid for it and being part of the NHS. The other thing I'd say to you, the email address at the bottom there, I monitor that. So if you have got any other questions, and I know somebody earlier said that they wanted a conversation, perhaps something a bit more private, please get in touch and we can have a conversation. It can be on the phone, it can be on Microsoft Teams, however you want to do it. So yeah, please get in touch. Finally, for me, just to say thank you all very much for coming on this webinar today, and thank you very, very much for your questions. We would very much like an evaluation from you about what you thought and how we can perhaps do things differently next time. And equally, if there's any of you go on to have some successes and you know, come into the NHS, it'd be really lovely to know about that. Then we know where we're sort of going in the right direction with these sort of webinars. So thank you very much. I don't know whether you've got anything else, Gaetano.
Yeah, thank you, Jane. Are you okay with another couple of questions?
Yes, of course. Yes.
Okay, so Juliana is asking, how long do you have to? How long do you have to work with a company before training for apprenticeship?
I mean, it could be immediate. It could be that the particular job role that you've applied for is an apprenticeship. So you start sort of a couple of days into your, once you've done all your induction, it could be your apprenticeship starts then. Could be you might work for 6 months and then your manager says, well, actually, I'd like you to do this development now. It's variable, and the managers sort of decide when they want to put you on these apprenticeships.
Linda, do you know if there are any roles or volunteer roles locally for hydrotherapist assistant for the disabled children and adults?
I don't off the top of my head. I'm just thinking perhaps Chailey Heritage. I think that comes under the NHS banner. I think it comes under Sussex Communities buildings. So it might be worth having a look on their website or contacting them even directly and asking them. I don't know about a lot of the trusts. I know Eastbourne Hospital has got a hydrotherapy pool. So it might be, I mean, Jill that spoke to you earlier is from East Sussex Healthcare. So it could be have a conversation with Jill, and you're going to have her contact details later on today or tomorrow. So yeah, I'd say contact Jill or Chailey Heritage for that one.
And I think that's it. I just want to go through some wonderful feedback that we've already got from Julie. Thank you, Jane and Gillian. It has been extremely useful to me. Lots of information to help me along to apply for a job within the NHS and to investigate further training. Daniela says, thank you so much. Thank you so much for today. Lucy, thank you. Same from Linda, thank you. This webinar has exceeded my expectations and been completely informative. A big thank you, Jane. And lastly, Sarah, thank you for this session. It's an eye-opener that we have a lifelong career opportunities in the NHS. Same for Cheryl. Thank you so much.
That's lovely. Thank you very much for that feedback. That's really lovely to hear, and I'm glad it's been useful. Thank you.
Okay, so we can wrap up, everybody. So thank you again for being here, actually, and for your contribution with your questions. As I was saying, you're going to get the possibility to leave us your feedback in writing as soon as the webinar will be over. You will also receive a follow-up email. With regards to the recording of the webinar, it might happen this evening, or maybe tomorrow. We do some bit of editing to just delete what's not necessary, like pauses and stuff, and then you'll get the webinar sent to you via email so that you can enjoy it. Okay? Thank you very much. Thank you very much, Jane, and until next time.
Okay, thank you. Thank you, everybody.
Bye.
Bye. Thank you.